All right, thanks for staying with us on TVC Breakfast. Now, because the issue of yellow fever is one thing that comes and goes. People are very familiar with the word yellow fever, but the point there is, people don't really get to know what it is.
You know, the memories of yellow fever that I have. Remember Fela's yellow fever? That's what we grew up with. And, you know, on a very, very serious note, yellow fever, when you had to travel to Europe, you just went, you know, got your inoculation to protect you against yellow fever. Was it to protect you or to protect the country that you're actually traveling to? I don't know.
To protect the country, but the point there is a good thing for you as well.
It's a very good question you asked there. What exactly is yellow fever?
Yellow
because
fever.
honestly, I really don't know what it's about. What are the symptoms, you know, and all of that. How bad, you know, is it? How seriously should we take it? How deadly can it be?
We'll certainly look at all of those things. And when you're talking about yellow fever, some African countries are vulnerable. In fact, there's the outbreak of this now in Angola, you know, Democratic Republic of Congo. And then you have the issue of the outbreak of Lassa fever recently in Delta State.
In Anambra.
State. And then the issue of Zika virus. It's not gone yet. All those who went to Rio Olympics have spread back to
one of the major
now.
Concerns I have as we're preparing for Rio Olympics, and you know, of course, you had the outbreak of Zika virus. My concern and the question I kept asking is, what exactly are the measures put in place to ensure that the Nigerian contingent that go to Rio don't come back with Zika?
You remember we asked these questions here when they were preparing to leave.
I doubt if I was satisfied with his response.
Well,
he too didn't have much confidence.
Yeah, but the point there is, when you don't have, for instance, this Olympic is one of those that was poorly prepared for. When you don't have real budgets going into preparation for the Olympics, because preparation has to do with also the medical checks on all of those things that go around it.
Yes.
So when you don't have those preparations for even allowances and bonuses and all of that, you can't really have guarantee that the medical personnel, all the medical equipment and all the kits that are supposed to go with them to check everyone, all those things would be on
And
ground.
now that they are back, was there any measure in place to check them one by one to ensure that they didn't come back with the Zika virus?
Well, it's most
And
likely
we
they
have
would
not
have,
heard anything about that one.
They may not be checking them like they do for Ebola. You remember the days of Ebola where when you're coming, there's this thing like the gun.
And we don't see that anymore. It just shows you that we seem to just let down our guard when nobody's talking about these things anymore. Does it mean it's no longer a threat? We're no longer in danger of Ebola, for example? No.
Yeah, let me tell you, there's no longer a threat for Ebola.
Okay.
Let me say that.
Oh,
I'm not
all
a
right.
medical doctor,
All right. And what is our Center
not
for
the
Disease
authority.
Control doing? You know, we talk about all of this and how the foreign countries are providing vaccines and all kinds of things. They're doing research. What are we doing really to
the issue of vaccines,
be more proactive on our
the issue
part?
of vaccines. In fact, with the population increase, there's a shortage of
yellow fever
of
vaccines
yellow fever
right now.
All right, now the Nigerian Academy of Science is calling on the health community and the general public to prepare for yellow fever outbreak. Now, the scientists reason that since some African countries are currently dealing with the virus, there is a possibility that it could spread to Nigeria.
Yes, and Vivian Erikefe reports about that.
In the West African zone, Nigeria is the only country that has not embarked on preventive mass campaign on yellow fever. Although yellow fever has been introduced into routine immunization, but the coverage is not enough. 23 million Nigerian children are estimated to be at risk of yellow fever because of low coverage of vaccination. The current outbreak of yellow fever in some African countries prompted the discussion of Nigeria's preparedness at this forum.
As long as we're having cases in Angola, in DR Congo, we never knew it would go to a place like China or if it were Kenya. China and Kenya were able to stop it because they were prepared. Because they were prepared for the so we need to be prepared in case one or two Nigerians come from all those places. You may ask me, where it's been going on, why have they not come? We can't determine when they are coming.
Support for local production of vaccines was mentioned as important to sustaining immunization strategy in the country.
The issue of local production of vaccine is a fundamental public health security issue. The private sector is ready to come in and make investments. But government buys more than 95% of vaccines that are used in Nigeria. And no private sector company would invest if there is no guarantee that government will take off these products when they are manufactured.
The laboratories that will do the diagnosis, the good disease surveillance to detect if it's occurring, we don't have it. And until that's the first step. If you don't get that in place, you won't even know you have the problem. I mean, you remember when Lassa came, it dragged on for so many months before the lab confirmed it. And the luck we had with Ebola was the fact that there was a lab that did a quick diagnosis. Without it, it would have been a problem.
The last yellow fever outbreak in Nigeria happened more than a decade ago. Yellow fever is an acute viral hemorrhagic disease and is transmitted by infected mosquitoes. Symptoms of yellow fever include fever, headache, muscle pain, jaundice, nausea, vomiting, and fatigue. Vivian Irike, TVC News.
Right, joining us now is public health consultant, physician, and state epidemiologist.
Yes,
Lagos State Ministry of Health.
It is a tongue twister, Mike. You can be sure of that.
Dr. Ismail Abdusalam, it's good to have you join us right now.
Good morning. Thanks for joining us.
Good morning.
Thank you.
Yeah.
And from our Abuja studio, we also have joining us an epidemiologist, Sani Goza. Good morning. It's good to have you, Sani. Okay, let's start it this way, Dr. Abdusalam. The issue of yellow fever, what's the difference between yellow fever and malaria? Can we, first of all, have that basic understanding?
Well, very simple. Yellow fever, malaria fever, they are both mosquito-borne disease. So that is the similarity there. But the difference is that yellow fever is caused by yellow fever virus, and it belongs to the group that they call the flaviviruses. The malaria is caused by a parasite, Plasmodium species. Depending on the type of species that we're talking about, the one that is very, very common here is Plasmodium falciparum. We have the other species, Plasmodium malariae, Plasmodium vivax, they are there. But, the presenting symptoms for malaria, we all know, general body pains, fever, and co. And yellow fever as well. Fever is number one from yellow. The yellow that is there is because of the yellowness of the eyes, the jaundice that the patient have. Then you have other symptoms that are similar to other common diseases: muscle pain, joint pain, loss of appetite, vomiting, and the other. So, but yellow fever, as we know, it belongs to the family of the viral hemorrhagic fevers.
Okay, so how bad is yellow fever? I mean, when you talk about malaria, the average Nigerian really is not scared, is not worried, because he believes he can just go to the chemist or the pharmacist and get that anti-malarial.
Well,
how bad is yellow fever?
Yellow fever is
have we even defined it? Yes,
well,
you have compared it with malaria,
yes,
but we need to get a clear definition of what yellow fever really is.
Yellow fever itself, as I said, is a mosquito-borne disease, meaning that there is a vector. And that vector is a mosquito. And that mosquito is Aedes species. In our area here, we have Aedes species, we have homozygous species. But the Aedes species that is common here is Aedes aegypti. And it's the same thing as the vector that causes the commonly what we have all around in South America and recently the Zika virus. It's the same species of mosquito that causes that. And so what happens is that it's the same method of transmission that you have with malaria, because the infected individual bitten by the Aedes aegypti, the virus goes into there, it moves around, bite another uninfected individual, and continue to spread just like malaria, but is a bit deadlier than malaria because it has the similar features like that of the other viral hemorrhagic fevers, like dengue fever. We're talking about Lassa fever, even though that one has another vector entirely, which is a rat. And then for Ebola, not well defined. So we have, it's not in the same, category as malaria in terms of the expression of symptoms and then how deadly it is.
From the moment of being infected or being bitten by this vector, which is the mosquito, to the time it shows that, yes, this is
the
really
incubation period
yellow
is
fever.
within 3
Thank
to
you.
6 days.
3 to 6 days?
Yeah.
Okay.
That's for yellow fever. Within 3 to 6 days. So, and you can see. So it means within 3 to 6 days, then you can see how many cases you are going to be having.
All right, we have Sani Goza from our Abuja studio. Sani, it's good to have you join us. Now, in Nigeria, how endemic is the issue of yellow fever right now? Because it's been on the front burner of media right now as to the prevalence of yellow fever. Give us the statistics of how bad is it right now across our country?
Well, specifically in Nigeria, the issue of yellow fever, as of now, we do not have any case that has been diagnosed. And the last case we had was over a decade. And the issue now of concern is the vulnerability. Nigeria has a vulnerable population that needs to be protected. But fortunately, some actions have been taken in the recent past that have improved that risk or improved the situation. The fact that Nigeria has embraced the introduction of yellow fever vaccine into EPI routine immunization, that has protected a large number of children, and also we have a policy of travel vaccination. Anybody traveling out of Nigeria to most countries or to countries that are vulnerable, but indeed as Nigeria is vulnerable, many countries demand that Nigerians produce an evidence of yellow fever vaccination, and that has given us a large pool of travelers or people who have ever been exposed to travel that are well protected. Although, like I said, the risk is there, we've not reported any cases, but also additional risk is growing in the region because more countries are reporting yellow fever in the last 1 year. And that is a major risk to Nigeria.
Okay, let me stay with you. What exactly is responsible for the reemergence of this disease? I mean, for a long time, we never heard much about yellow fever, and all of a sudden it's now on the front burner when it comes to public health concerns. What's responsible for this?
A lot of factors. There are factors that are related to environment, factors that are related to people traveling, and factors that are related to people's immunity, and many more. But let me take them one by one. Starting with the factors of immunity. When you have a large cohort of people vaccinated, that cohort is protected and they have herd immunity. By the time the vulnerability reduces, people lose focus in vaccination, the herd immunity keeps coming down, and as a cycle comes up, where after several years, the number of people that are vulnerable outweighs the number of people that are at risk, it now exposes the entire population to another round of a major epidemic. Two, the environment is changing. More forest zones are being converted into urban habitation, into residential habitation, into industrial settings, where now you are bringing people that are normally in an urban setting, they now come to fringes of forest lands. Those forest lands have animals that are known to have been reservoirs of the infection, like monkeys. And there are also vectors in that region. Like my friend, my colleague mentioned the Aedes aegypti. We also have Aedes africanus. Aedes africanus is the one that bridges the infection from monkeys in the peri-urban areas into human population. There is also the sylvatic or the sylvan Aedes species that also increases the risk of infection between monkeys and humans. Then the Aedes aegypti completes the cycle between humans and humans, and that increases the vulnerability. And like I said, vulnerability increases once in the neighborhood there is another country or another population that is being infected, and that is where we insist on protection of travelers. Either for you to, you are protected from carrying the infection to a foreign land, that is what we call exportation, or bringing it into the country, importation. But the fortunate thing is that now science has proven, once given yellow fever vaccine once in your lifetime, you have lifetime protection. You don't need a second dose anymore, provided that first vaccine was done effectively and done well.
Wow.
That's good to
That's
know.
encouraging to know. But okay, fine.
Okay, so that means I'm protected for life then, because I remember taking...
Insurance covers you for life.
Yeah, I think I took
Yes,
one
the
in
protection
79.
is for life.
Oh, that's great. But I wonder why we're not, why we shouldn't then have these cases. It shouldn't be a problem anymore, Dr. Ismail.
Well,
No, let me ask Dr. Ismail Abubakar in the studio.
well,
Abdulsalam,
yeah. Well, I think Dr. Guazo has gone through marriages of, the reason why the population should be protected. And, well, in Nigeria, as he has said, for now, we have not recorded cases, but active surveillance is going on in the country. And I think we should also look at the yellow fever not in isolation. We need to look at it with respect to other diseases, because we have, which he knew as well, and he is consultant has been held in Abuja. He knows that we have an integrated disease surveillance and response system, whereby on weekly basis, on daily basis, we have cases being reported by the health facilities to the local government, to the state, and to the federal. So those ones are going on to trap whatever is happening, and is a very good and solid system that is, throughout the country. So in that respect, we'll be able at any point in time to have suspected cases.
Okay.
Suspected cases, and then we respond appropriately. So that is in place. Another thing that is also assisting us is that the vector that transmits, the yellow fever virus is the same as a vector that transmits malaria. So some of the environmental management issues that we do for malaria is the same thing that we do for yellow fever. Because when you talk about indoor residual spray, which Lagos State is actively doing and is research-based, evidence-based, that is, you spray with, the adult mosquitoes around the houses and everywhere. They, at that particular point in time, they are being prevented. So, and then aside that, you have larvicidin. For example, in Lagos State, we do it in about almost 10 LGAs that this IRS is being done, and before you can do it at all, there are entomologists who carry out researches on the chemicals that are susceptible to that. So that is going on. That is one
what
part
you're saying
of it.
then is
Yeah.
the job is quite thorough. And
Yes, it's the same thing, because
worry.
these mosquitoes, they, the larvas, they hatch their larvas in what? The containers, the unused tires and coal that we have all around. When you have bushes that are not clear around your houses, when you have stagnant water around, all these are things that, because without the vector, the virus cannot be transmitted. So that one is very, very important.
That's quite reassuring. But based on Vivian Irikefe's report, there is no preventive mass campaign right now against yellow fever in Nigeria. We'll come to that right after this.
Yeah, let's bring some other perspective to the issue now. Yellow fever is an acute viral hemorrhagic disease transmitted by infected mosquitoes, now typically found in sub-Saharan Africa and tropical parts of South America. The disease is transmitted by the Aedes aegypti mosquito that also spreads Zika and dengue. Certainly, Dr. Abdulsalam has mentioned that earlier. Although it is a far more serious disease with death rates as high as 75% in severe cases.
That's quite high. Now, some of the symptoms of yellow fever include fever, headache, jaundice, muscle pain, nausea, vomiting, and fatigue. Large epidemics of yellow fever occur when infected people introduce the virus into heavily populated areas with high mosquito density and where most people have little or no immunity due to lack of vaccination. In these conditions, infected mosquitoes transmit the virus from person to person. Many countries require proof of vaccination against yellow fever before a visa is issued, particularly if travelers come from or have visited yellow fever endemic areas. Okay, so let's bring in Sani Goza. Okay.
Yeah,
well,
but
this is where we have to say bye to our viewers on TVC Entertainment. But of course, you can continue with TVC Breakfast on TVC Nigeria on Concert Channel 190, DSTV 418.
You can also keep a tab on the program on GoTV Channel 45 and ACTV 510. All right, if you're just tuning in, you're watching TVC Breakfast, and we're discussing yellow fever this morning. And we have in the studio right now Dr. Ismail Abdusalam. He's a consultant public health physician and state epidemiologist with the Lagos State Ministry of Health. And we also have in our Abuja studio Dr. Sani Goza. He's also an epidemiologist, and we're discussing this. Now, we were talking about the issue of let me use the word fumigation earlier on. Dr. Goza, let me come to you on this. Dr. Abdusalam has talked about what Lagos State is doing to fumigate the environment and all of that. When it comes to the large scale, so that Nigerians can rest assured we don't have this anymore, how possible, how feasible is that, using maybe helicopters or things like that to fumigate the entire city or the entire society?
When you're talking about small area, a whole large area like the whole country, it's not something that can easily be contemplated or done because of the huge cost implication. But the micro level activities that Lagos State is doing and some other states are doing are very effective and should continue while the federal government continues to map out the bigger picture. The bigger picture right now, we have a crisis across the world, that of availability of vaccines. Like you know, yellow fever had been on the decline until the recent upsurge in Angola, which moved to several other countries, Kenya, China, and DRC. And of recent, we had an alert from even our neighborhood here in Niger, a state called Difa in Niger Republic. So the challenge of vaccination is even bigger, and that is what we are facing. One of the issues, I'll come to the other ones. One of the issues that we're facing, the issue of vaccine shortage. It had reached a crisis stage where one of the countries that has a large population and has a huge threat, like Congo Democratic Republic, is even seeking approval of WHO, and they've already been given that approval to use fractionate vaccine. Fractionate vaccine is where instead of administering one full dose to a person, you can divide it into 5 places, 4 to 5 places, and give it to 4 different people. It gives the same protection, but it's the duration of protection that differs. It may take a year or 2 protection, which you need to repeat afterwards. But that is the emergency situation we are in Nigeria. And I know the Honorable Minister has been constantly in touch with not only with WHO Afro, but with WHO headquarters in Geneva to ensure that Nigeria gets a very, very commensurate or adequate supply of yellow fever vaccine to protect the population. 2, like I said earlier, we are working hard on making sure that anybody coming in, our points of entry, you hear people carelessly saying that our points of entry are porous. That is not true. We have I was until recent the director of Port Health Service. We have well-documented ports, and we have a resilient port health team in each of these areas, well-manned, and we screen for people going out and people coming in. And we make sure that they are vaccinated. So one appeal that we have for Nigerians is everybody going out should insist, and I want to plead with every Nigerian, we should insist on getting the relevant counseling. If we have been vaccinated on yellow fever before, there is no need to get a new yellow fever injection, but you can get your yellow card updated. But if one has not received this before, then the person should get the yellow fever vaccination and also get the yellow card. We must not go for touts. And again, the protection needs to be 10 days. Our scientific evidence shows that from the day you receive vaccination to the day you develop sufficient antibodies in your system to protect you is a minimum of 10 to 21 days. Therefore, we do not advise people to go into the airport and just go for vaccination for the sake of getting yellow fever evidence, a yellow card evidence, but not for protection. So Nigerians should protect themselves. Then also another area that government is concentrating is that of routine immunization. There is currently sufficient supply of yellow fever vaccine in our routine immunization system. And once a child is vaccinated and protected, that child is protected for life. And I advise parents to keep the evidence for the children because we will need that in future in administering yellow cards for their future travel needs. Again, the environmental side, and this is where states and local governments come in. States and local governments need to protect the local population environmentally and also through control of the vector, which is in the urban case is the Aedes aegypti, in the peri-urban setting is the Aedes africanus, and we also have the sylvanic transmission. All these mosquitoes are amenable to insecticide control, they are amenable to vector control, and they are amenable to environmental control. There is no two way about it. Once we combine these three methods, protection of the vulnerable population, protection of the environment, destruction of the population of vectors, and even their progenies, that is the eggs and the larvae, that will give us that will reduce the threat of yellow fever in the country.
All right, thank you so much. Just hold on, let's quickly bring this in. Since the WHO launched the yellow fever initiative in 2006, significant progress in combating the disease has been made in high-risk African countries, but vaccination rates remain too low.
No outbreaks of yellow fever were reported in West Africa in 2015. Now, yellow fever is re-emerging in Africa at an alarming rate. 32 African countries are now considered at risk of yellow fever, according to WHO.
Yellow fever can be prevented by vaccine, but the vaccine is currently in short supply globally, raising the risk of contracting the disease. About 90 million vaccines are normally produced yearly, the majority of which are used in regular vaccination programs. 6 million doses are usually reserved for emergency stockpile, but this was depleted for the first time ever this year as response efforts continue in affected areas. Affected countries.
Yeah, certainly. Now, international charity Save the Children has warned that the outbreak could soon spread globally if not contained. A previous outbreak, which began in 1986 in Nigeria, infected 116,000 people and killed 24,000.
Between 2007 and 2012, all the countries in West Africa except Nigeria conducted a mass preventive vaccination against yellow fever. The country only paid attention to vaccination in areas believed to be at risk where there were outbreaks and border communities that have recorded yellow fever outbreaks. Now, presently, more than 100 million Nigerians are classed as vulnerable. I just want to stop there. I want to stop right there.
Vulnerable to yellow fever.
100 million. That's massive. I mean, out of a population of how many?
I think that majorly is due to other factors. The issue of traveling. The world is a global village. Business, trading, internationally, Nigeria moves from one country to another. So the risk of bringing in importing the infection into the country is very high. We're mobile, we're all everywhere. So that is another.
And there's not much campaign, mass campaign going on right now, according to our reporter there.
Well, I think the campaign has started now. And
this is campaign.
Another thing I know is that, you see, at times I always believe that holistically we look at all the diseases together, because when you leave yellow fever now, another disease will come up. And I think Dr. Gwazo has mentioned a very important factor. There are other issues that we need to consider. Issue of global warming, climate change, that increase the vulnerability of these vectors to coming out, and then the issue of our own man-made activities like bush burning, moving to the forest. So we're driving the vectors into, you know, the domestic areas, and that also is
in 2012, there were efforts to, government was talking about trying to start producing vaccines locally. How is that project going?
Well, you know, I know that there are a lot of frantic efforts being done by the Federal Ministry of Health to make sure that most of these things are done, but I know they are in stages. And when you talk about the issue of development of vaccine, it's, you know, it takes a lot of processes. But I know that there are other challenges. If you know, along with that too, we have the other issue. You know, earlier this year too, we have the issue of Lassa fever outbreak. So there are several issues coming up that government is trying to face. But major thing we have to know is that at any point in time, there is integrated disease surveillance and response system in place, aside the issue of mass vaccination and co. And for yellow fever, I think the issue of routine immunization, the issue of travelers moving to endemic area, we an endemic area moving to other areas, getting ourselves vaccinated and
that
showing
really
evidence
needs
of
to
that
be
international vaccination. Yeah.
Well, we have to move on now to other issues, but thank you so much, Dr. Abdulsalam Ismail, Sani Goza, both epidemiologists, talking to us on the yellow fever outbreak in parts of Africa. Thankfully, it's not yet in Nigeria, and we hope it stays that way. Stay with us.
Thank you, gentlemen, for coming.